What's up, guys? Didn't really even think I would be doing a video about this, but for some reason I just had a really strong urge to make a video for some reason. And normally I really don't like recording myself, so see how it goes. But so today's Thursday, September 5th. Not quite 24 hours post-op, but this time yesterday I was in surgery for a L5-S1 microdiskectomy because I had a really bad herniated disc. Surgeon said it was bad as I can get as far as herniated discs. So yeah, I didn't do any videos really pre-op because again I wasn't even planning on doing videos, but yet here I am. Man, I wish I'd put my contacts in and my sunglasses on. I don't normally wear glasses. I've just been wearing them yesterday and today because so kind of feeling. But so far as my back, it feels great. Beforehand, so a little backstory. I was playing ice hockey. Had my feet taken out from underneath me as a fast play. It was completely unintentional. And I fell basically straight down on my butt and lower back area. Hurt initially because it was like, ow, I just fell on ice. But I got right back up, got right back into play. About a week later, I started, sorry for the camera shaking too, I'm not used to taking videos of me. About a week later, started having muscle spasms and pain going down my left leg. So me being hard-headed and stubborn, I ignored it. Finally, so the initial injury happened about the end of June, or end of July. But really didn't go see a doctor until I'll edit that part out because I'm getting all my days confused. Happened about the end of June, and I didn't go see a doctor about it until the last week of August or July. Forgive me, I'm got a bunch of different pain meds going, so I'm kind of loopy, not thinking straight. So he's like, yeah, you got muscle spasms and pulled muscle in your back. So we'll give you some muscle relaxers, start you on some physical therapy, we'll see how it goes and everything, and then we'll go from there. So a couple weeks later, I was at work and I just had the worst pain I've ever felt. It felt like somebody was just squeezing all the muscles and nerves and spinal cord in my lower back with a glove that was basically on fire. Is about the only way I can describe it. Severe pain going down my left leg all the way to my toes. My leg was numb. And I couldn't do anything to relieve it. Sitting down made it worse. Standing made it worse. Walking helped some, but not a whole lot. So I called my doctor back, left him a message, and I was like, hey, something ain't right. Something needs to be done about it, or I need to get an MRI or something. So they called me back later that day, scheduled an MRI, went and had it done, and went back about a week later to go over the results, and he was like, yeah, you got a herniated disc in your back. It's pretty bad. Normally I don't refer my patients to a surgeon first thing, but that's probably going to need to be fixed surgically. So my initial reaction was like, oh, great. So got a referral. That was, I think, on a Wednesday. I saw him like first thing that Friday morning. He was like, yeah, that's bad. That's pretty significant herniation. It's pressing on the nerve and everything, and it's physical therapy may help a little bit. You know, we can try injections and stuff, but you're eventually going to need surgery at some point. So he was like, take the weekend. Just, you know, go over everything. If you want to go get a second opinion, I encourage it if it'll make you feel better. But your case is pretty clear cut and dry that it's a severely herniated disc and you're going to need surgery. So took the weekend, went to the concert, Alan Jackson concert, which was awesome. Highly recommend y'all going to his concerts if you get a chance to go to one. But I was miserable the whole time. Sitting down did not help at all. So I called him that Monday. I was like, yeah, I'm probably going to want surgery. So they called, I think it was, or I called that Tuesday because I think it was Labor Day or something. I don't know. I'm getting all my days mixed up now. So they called that Wednesday, said surgery is scheduled for the following Wednesday at 11 o'clock. So I said, okay. And the week leading up to yesterday was awful. It is probably the worst experience I've had with this overall. I was on light duty at work. I'm a firefighter with my local city. Luckily they have a light duty program, so I don't, burn my sick time that I'd saved up. I was basically spending the whole time I was there in a little mat room that we have, just trying to stretch it out, trying to get the muscles and everything to just relax so I can get some sort of relief, because it was miserable. Unless if I was up walking around, just constantly moving, I was hurting. This video quality's gonna be awful, but yeah, and I wasn't able to take anything except for Tylenol basically, and that wouldn't even do anything, so I stopped taking the Tylenol and just dealt with it basically. So fast forward to yesterday, checked in at the hospital about 8 o'clock. Surgery wasn't scheduled to start till about 11. So they did all the pre-op stuff. I talked with the surgeon, talked with a couple nurses, anesthesiologist, went through all the pre-op stuff, all the paperwork, answering questions after questions after questions. And then surgery really didn't start till about 11:30. Or at least I didn't go back to the OR at about 11:30. But went to sleep, woke up, I think it was 1:30 or 1:45, close to 2, somewhere in there. When I finally woke up in the recovery room, was really groggy, had a sore throat. You can probably tell I sound scratchy. But overall, I felt 10 times better than before. It's probably a combination of the pain meds that I was on, and just waking up from anesthesia and everything, and so I was groggy, but I felt great. No shooting, burning pain going down my leg, no numbness, or at least not as bad as it was before. I was able to lay in the bed comfortably, because before the surgery started I was tossing and turning the whole time, just trying to find a comfortable position. Finally, I found one about 10 minutes before I went back to the OR, but afterwards I felt great. Went home yesterday afternoon about 3:30, 4 o'clock or so. Went to CVS, picked up a couple prescriptions, and then just chilled at my mom's place for the rest of the day. Went to bed about midnight. Woke up about 4:30 to take another pain pill. Just kind of helped get me through the night. Really didn't even need it, but I didn't want to wake up and it be, 8 hours since the last one I'd taken and be hurting. And plus the surgeon just said that, keep on top of the medicine and stuff. Once you start to feel like you don't need it, start winging yourself off of it, but especially for the first couple days, keep up with it. Keep up with that and the muscle relaxer and stuff. So I've been doing that. Sorry. Today, woke up, felt great. Was able to get up, move around. No pain, no shooting, burning pain going down my leg. My leg and toes are still a little numb, but he said that would probably it could take upwards of a couple months for that to go away. It's one of the last symptoms to really go away after this kind of surgery, because the nerves are they're healing and everything. It's just going to take time. So, which, I understood going in, so I'll take it. I don't see how people could put up with this for longer than the 3 months that I did. Because it's debilitating. You can't do anything, and when your back hurts, everything hurts. It's just you don't want to do anything. You don't want to talk to people. You don't want to interact with them. You just want to be left alone in your own little world of misery, basically. So today, I'm just taking it easy, walking around outside, just enjoying this nice little weather that we got before any effects of Hurricane Dorian comes in. We're pretty far inland, so I don't think we'll get too much. Might get some rain and wind, but nothing like what the coast is going to experience. Fingers crossed that we'll be able to go to the beach this weekend. Doubt it, but fingers crossed. My thoughts and prayers go out to everybody in the Bahamas and everybody in its path. I know it sounds cliche, but it's about all I can do right now. Better than nothing, I guess. But, so yeah, first couple days, he said take it easy, just walk to the mailbox and back. Try to limit sitting for no more than 30 minutes at a time, unless for your sleep, obviously. So I've just been getting up, walking around, taking it easy. Probably take a shower tonight, which will be interesting, because he said to keep the incision and dressings dry, so I'll basically have to saran wrap my waist and back to keep it dry. So that'll be interesting, but at least I can take a shower. It'll be nice to finally take one. I was worried that he was going to say, oh no, you gotta have sponge baths. So, but overall, I know it's really still not even 24 hours post-op, but I'm really happy with how things have gone. Next time I do a video, I'm putting my contacts in. Really happy with the results. Time will tell the following days to weeks to month on how I feel. First 2 weeks, won't be able to do any driving, so I'll be having family chauffeur me around, which would be pretty cool. Sorry guys, but so yeah, after that, hopefully I'll be able to drive, or be given the okay to drive my follow-up appointment on the 18th, and be cleared to go back to work on light duty after that too. But except for the first 6 weeks, we were wearing this fancy brace. No lifting, no bending, no twisting, no sitting for longer than 30 minutes. Just don't overdo things. Try to walk as much as my pain tolerance and body will allow. He said use your body as your guide. If you start feeling overly stiff and sore and you start hurting, go lay down or go sit down, go take a rest. Don't ignore it, don't overdo it, don't rush it, because he said with how bad my herniation was, most everybody's about a 5 or 10% risk of re-herniation. He said mine was about 15% risk of re-herniation. So definitely something I don't want to go through again. Also had an L4, L5 bulging disc, but it wasn't herniated. But L5-S1 was herniated pretty bad. So after the 6 weeks, hopefully get this brace off and start physical therapy. Start working on getting my strength back. Definitely in my left leg, because I can tell that it's weaker than my right leg, just because I've been nursing it. Definitely been walking with a limp and trying to just not put a whole lot of weight on it up until this point. So be starting physical therapy and hopefully be back working and playing hockey by end of November, early December. Be a nice early Christmas present if I can get back to work by then. But not gonna rush this. Definitely don't want to overdo it and risk re-herniating it. Because then he said if I do re-herniate it, he'll have to go back in, take out the part that's herniated, and fuse it. So it's definitely not something I want. Being as young as I am, I'm only early 30s, early 20s, excuse me, good grief. So yeah. Again, didn't think I'd be doing a video, so this is probably the worst video y'all have ever seen on YouTube. Apologize for it. If you want to critique me on it, that's fine. Again, I was not planning on doing a video, just got a sudden urge this morning to make one, so didn't really have a game plan on what I'd say or what I'd do. Just winging it. So I guess I'll be keeping y'all posted on how the recovery process goes, because I know there's hundreds of videos out there on different people and their experiences with it and everything. I was like, I'll just do one, shoots and giggles, sorry. Trying to keep it PG. So, probably do one maybe a week from now, see how it goes, and then definitely one after my 2-week follow-up. Then month out. So just, if anybody wants it more frequent, just let me know. Again, I didn't think I'd be doing a video, so this is very put together, last minute, impromptu. Probably the worst video y'all have ever seen on YouTube. And probably making an embarrassment out of myself, but you know what? Who cares? I can blame it on all the sweet pain meds they got me on, which, here again, I don't really need, but he said to keep up with it, so I'm following his orders and keeping up with it, so I don't, end up in too much pain and have to be waiting for it to kick in and just be sitting there in agony. So, but yeah, I guess that's it on my first video. Hopefully it wasn't too back and forth or too confusing. Hopefully y'all can understand me a little bit. And I know it's kind of breezy outside, probably not the best time to be doing a video outside. I don't know. I'm not, like I said, I'm not used to taking videos of myself or just doing videos like this, period. So it's a learning experience. So yeah, I guess. Oh, and I'll leave the doctor's name in the info if anybody wants a really, really good surgeon. I highly, highly, highly recommend him. Super nice guy, super understanding, willing to listen, to explain everything down to every single little detail. Coming from a medical background, I had some knowledge of what to expect and everything as far as the surgery process and the pre-op and the post-op and all that stuff. But I mean, he took the time to explain it in layman's terms. Made sure my mom understood everything that was going on, because she was with me all day yesterday, and he really took the time to make sure that we both had all our questions and concerns and anything answered, and we were as informed as we could be about the whole process. So I really, really highly recommend him. If you're looking for a surgeon, if you're in the same predicament that I am. Hope not, because I definitely don't wish this on my worst enemy. It's definitely been an eye-opener, that's for sure. Made me realize just how easily life can change. I mean, I know it's not like, open heart surgery or a stroke or something along those serious terms. And I'm not, trying to take away from anybody that's been through those experiences, or even cancer. I know several people that have gone through cancer, and I wouldn't wish that on anybody. But, like I said, when your back hurts, you feel miserable. And when you can't do anything, you feel even more miserable. So it's been an interesting ride so far. I know I'm going to have a lot of ups and downs as far as recovery and trying to be patient and not rush it, because I'm hard-headed. I'm ready to get back to work, get back on the truck, get back to playing hockey. But I don't want to risk re-herniating it, or any other disc for that matter, and have to have it fused, and really truly put my career in jeopardy. Because that was one thing I was worried about when surgery was mentioned, that I wouldn't be able to be a firefighter anymore, and I wouldn't be able to play hockey. So that was tough. But after talking to my surgeon and everything, he said that as long as you do everything I tell you to, and the physical therapist, and you don't overdo it, just don't be stupid. I can definitely see how people rush back into things too early, because I feel like I can take this brace off and be fine right now. It's been, last took a pain pill at 7 this morning, and I really don't feel any pain. I'm stiff and sore, like I had a really intense back workout, but nothing compared to what it was like before. So I can definitely see how people rush back into it too quickly, and re-injure themselves. So definitely going to be working hard to not do that, not be stupid and hard-headed like I am, and listen to what he says, follow all the instructions that he gives me to a T, listen to the physical therapist and everything, and just go through the motions and enjoy this 3-month extended vacation, I guess. So it's almost 25 minutes. Yeah, that's about all I got for the first snippet, I guess. This video is gonna be awful. God, it's gonna be awful. But it's hot over here. So again, if y'all want updates on how everything's going, be more than willing to share as much as I can, as often as I can. But if anybody's going through this same experience, good luck. I hope you find some relief, because it sucks. I'm not gonna lie. But if you're considering surgery for a microdiscectomy, I would highly consider it. Yes, it's major surgery on your back. It's a delicate area that can really affect the rest of your life, basically. Set yourself up for future problems. But it's amazing how much better I feel. It's just, I can't describe it. It's awesome. I truly can't thank the people, my surgeon, the nurses and doctors at Cone Hospital. I was gonna say that, but at the hospital, the anesthesiologist who was talking to me the whole time. That dude was awesome. Wish I could remember his name, but I can't. He was super legit, super chill, laid back guy. But everybody there, from the receptionist at the desk when I checked in, to the nurses in the recovery room, to the lady that wheeled me out to the car to go home, everybody from top to bottom, the entire time I was there, was fantastic. Truly, truly, truly recommend going there for any medical needs and surgery. Heaven forbid y'all have to go through something like this, or anything medical related in general, because I want everybody to live long and prosper. But, you know, take my video for advice if you want it, or don't, because I know it's probably a really crappy video. But again, just excuse me, still sore throat mess. But good luck to anybody that's going through this. Wish y'all nothing but the best. The folks out in the hurricane path, y'all be safe. Really, just everybody in general, be safe out there. Watch out for each other. Watch each other's backs. Take care of each other. Check on your neighbors. And be a good person. This world needs more good people than where it's going. Take care of each other. And y'all be safe. Peace out.